encouraging signs, at least in the battle against coronavirus infections, falling by 13% last week. So for this and more, we're joined now by Dr. Tom Tsai, assistant professor in the Department of Health Policy and Management at the Harvard Global Health Institute. So Doctor, again, a little bit of good news, but can we start cheering yet and saying that we're at least headed out of the woods, or can we?
Yeah, great to be here with you, Kristen. And I think this is a lot better news than we've seen than the last several weeks. And the data are all pointing in the right direction. There's been a decline in the number of cases, a decline in the test positive rate, which is now around 5.5% in a 7-day moving average. So all signs are pointing to the right direction. But I go back to what I said a few weeks ago was we started off this pandemic with a peak, and we were supposed to come down off a mountain and enter a valley. And what turned that instead into was a mountain range. So we're just still in the middle of the mountain range, too soon to celebrate. But the signs are encouraging that with increased testing and continued adherence to masking and physical distancing, that we can continue to build on the progress that's been made to control the pandemic over the last several weeks.
So to continue that metaphor, do you think we could start climbing up that mountain again in a couple of days or weeks, rather, as we just had the holiday weekend where a lot of people were out traveling? I saw even on my social media, anecdotally, a lot of people alarmingly were gathering maskless, having barbecues and going to parties.
That's a real concern. We saw a spike in cases after Memorial Day, largely driven by states reopening too soon without the adequate testing and contact tracing infrastructure in place. But we did see small bumps in cases after the July 4th holiday weekend, and that is a concern from Labor Day weekend as well. So too soon to see if that bump will materialize. My one worry, though, is that there is some testing fatigue, and what we need to do is now really move from the conversation about having enough testing capacity in light of the recent news this week with the Department of Health and Human Services purchasing 150 million antigen tests through Abbott. We need to be thinking about not just tests, but testing, and really thinking about a strategy of how to implement towards asymptomatic screening and surveillance. So again, let's see what the next couple of days show in terms of the rising cases. Again, too soon to rest on laurels.
So to that point, football starting, I'm sure a lot of people are happy about that. And Zach, just in the last hour, was chatting about this with the mayor of Kansas City about opening football stadiums. Now, the football stadiums are opening to only about 25% capacity, but wondering there if you think that perhaps it is a little bit too soon for us to be gathering in large groups to watch football games.
I think so. And, I go back to the original guidelines for thinking about reopening with each phase, and that's relying on 2 weeks of consistent declines in cases, 2 weeks of declines in test positive rate to make sure that we're actually basing our policy decisions on true signals and not just reacting to noise. And I think this applies to the football stadiums. A lot of these states and cities have had really hard-fought improvements in being able to control a pandemic. Let's not, take one step forward and 2 steps back. And I think it's important to still, follow through with the guidelines that have been working. And I think too soon for in-person games. I'm not worried about sort of people sitting in the stadiums. If they can sit 6 feet apart, it's how do they get in? How do they get out? And a lot of the social gatherings and around football stadiums. That is my worries. I think unless there are clear guidelines in place, too soon to jump in with both feet.
I want to ask you lastly, again, because we had the holiday weekend and Labor Day usually is the signal of the end of summer and the official start of the school year season. And, we make some vaccines mandatory to attend schools. I'm wondering if we get a vaccine, or rather when we get a vaccine. Some are saying, right, by election day, some are saying by the end of year. But wondering if when we do get a vaccine, if that should also be mandatory to attend schools going forward.
I think a lot depends on the safety profile of the vaccines. What we've learned is that nothing should proceed at a warp speed. And, the data from AstraZeneca this week suggests that, we have to trust the process. And this is how scientific discovery works. And we have these precautions with data safety monitoring boards in place for a reason, because we want to make sure that vaccines are safe. But just as in several areas, in high-risk settings, we've made influenza vaccines highly recommended. In hospitals, they've become mandatory. I think if we can prove that the coronavirus vaccine is safe, it would be reasonable to include that on a list of potential vaccines for school-age children to demonstrate once the safety has been demonstrated, in order to get kids back for in-person education, given all the benefits that we know come with that.
All right, Dr. Tom Tsai, Assistant Professor in Department of Health Policy and Management at the Harvard Global Health Institute. Thanks so much for joining us today.
Thank you.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.